The broadcast is now starting. All attendees are in listen-only mode.
Hello again, everyone, and welcome to this installment of the Practice Perfection web-based education series. I'm Danny Bobrow, President of AIM Dental Marketing, and it is my sincere pleasure to invite back to the Practice Perfection stage, by popular demand, Dr. Peter Evans. Peter is here today to share with us a case study entitled, Double New Patient Value and Have Your Patients Thank You for It. Dr. Evans earned his Bachelor of Science degree from East Carolina University and then worked in cancer research for the National Institutes of Health until he returned to graduate school and received his Master of Science degree in microbiology and immunology from the Medical College of Virginia, studying the chronic inflammatory process under Dr. Sean Ruddy, and was 4 short months from completing his research for his PhD when his passions led him to enter dental school. He has served as adjunct faculty at Virginia Commonwealth University, teaching undergraduate bacteriology, and in 1982 received his DDS from the Medical College in Virginia. Dr. Evans has completed well over 2,000 hours of advanced continuing education. He is recipient of the prestigious mastership from the Academy of General Dentistry. Peter is practitioner, author, speaker, internationally renowned dental coach, and founding member of the American Academy for Oral Systemic Health, which is how we met 3 or 4 years ago, and is an active member of numerous dental organizations. Dr. Evans' research and energy result in innovative solutions drawn from interdisciplinary fields, from genetics, biology, medicine, psychology, biomechanics, bioenergetics, and physics, to the emerging and evolving discipline of biocompatible dental care. He is a leading expert on the topic of biocompatible dentistry and its effect on total body health, practice performance, as well as team motivation, and is why we're so excited to have him join us again today. As creator of biocompatible dentistry for whole body health and the natural path to dental profits, Evans has helped dental offices across the country and abroad improve efficiency, patient care, productivity, and prosperity. As usual, today's event will run for 90 minutes. We invite you at any time to submit your questions using the question button on your screen. We will do our best to get to all your questions following Dr. Evans' presentation. If we are unable to do that, Dr. Evans has graciously offered to follow up with you personally. You also will receive an email by next week with directions on how to apply to receive your 1.5 hours of CE credit. Now, because today's presentation will be recorded and shared, we invite you to just sit back, relax, and enjoy Peter's talk. Participants are cautioned about the dangers of incorporating techniques and procedures into their practices if the course has not provided them with adequate clinical experience to allow them to perform it competently. And now, let's hear from Peter Evans on the leading edge topic of biocompatible dentistry. Hello, my friend. How are you?
Danny, I'm fine. It's a pleasure to be with you tonight. And I'm very excited about sharing all the information about some of these innovative and new concepts that are emerging right now that are impacting the evolving discipline of whole body dentistry. So, and we're going to go through quite a bit of it tonight. So I'll need some of your help, Danny, along the way. Also, I have asked Dr. Tom Kaczorek to join us tonight. And Tom, are you on the line?
Hi, Peter. Yes, I'm here.
Hey, wonderful, wonderful. So as I go through this, Tom, there'll be several things that you have got quite a bit of experience about that I might need some help on as we explain this going through this. So the title tonight is to show you a case study on doubling the new patient value and have your patients thank you for it. Now, that's a little strange. So my background is starting from the bottom. I've been a coach for 10 years or so. I've been a speaker. I write quite a bit. I've still got a full-time practice in Williamsburg, Virginia. I've got my mastership in the Academy of General Dentistry. Actually, I went through 2 mastership track courses. I taught undergraduate bacteriology at Virginia Commonwealth University, and that was a lot of fun educating the kids that were going into pre-nursing and pre-vet and pre-dentistry and pre-medicine. It was really cool. And I did that while I was getting my graduate degree, my master's degree in micro and immunology. And I studied under Sean Ruddy, who was the chairman of the Division of Immunology and Connective Tissue Diseases at the Medical College of Virginia in the Department of Medicine. And so it turned out that when I went to dental school, everything that we learned about inflammatory responses hit home with the periodontal disease that we know is rampant across the country. And I started it all out after college. I first got a job doing research for the National Institutes of Health up in Bethesda, Maryland. So I've done quite a bit, had a great time doing it, and now we have to talk about how I brought all that education down into dentistry and make it work for the business of our practices. So to double your new patient average, now the national average, depending on who you read, is going to be probably $1,200 to $1,700 per patient is the national average. Now, my thing is that I think we can double that fairly easily. So if you do double that, that would be $2,400 to $3,500 as an average value for a new patient. If we do that, then we've got pretty much of an office that is happier than if you're an average office in the country. You have dentistry
Peter?
for whole body. Yeah.
Could I just ask you a question about, I know you're just getting
Sure.
started, but we do quite a bit of work with patient value. And as you said, depending on what you read, there are different numbers. I really like and want to remind anyone who's attending that you can calculate this quite simply for yourself. If you want to rely on national averages, that's fine. And I think Peter's point is going to be anyway that regardless of where you are now, you can easily double it. But if you're interested in learning how to calculate patient value, both on an annual profitability and a lifetime value basis, please don't hesitate to let me know, because it's always eye-opening, and it really kind of, on the plus side, shows you what your return on investment can be. It also can show you perhaps where you are versus the national average and what opportunities there may be to grow that. I just wanted to interject that.
Yeah, there's a bunch of different values that you can calculate. The average across the board nationally is somewhere between those two numbers of 1,200 and 1,750, but you can calculate your own, and you can double that too. So for whole body dentistry is an avenue that is the easiest avenue to increase your productivity and profitability. And it's going to happen because the people who are learning more about how their dentistry impacts their whole body health are just part of the people who are taking their health very seriously for themselves and their family. They are becoming their own health advocates, and it's not slowing down. It's not slowing down a bit. So to double your practice your new patient value and have your patient thank you for it, how does this help the practice? How does this help the new patient? That's the kind of things we're going to be asking today and the questions that we're going to answer. So why would the new patient thank you for doubling their fee? That's a hard one. So you're going to have to ask, who are these people? And more importantly is who are these patients? So we know that 30% of Americans are going green. We know that 30% of Americans are buying organic. We know that 30% of Americans are recycling. And we also know that more than 30% of Americans are pursuing alternative healthcare possibilities. So when you take all that into account, I want to show you kind of the proof of the market right now. In 2014, there were more visits to alternative healthcare providers than there were to traditional healthcare providers in last year. Now, that is huge. So who are these people? Well, they're not a demographic. It's more of a combination of the population, the adult Americans, who subscribe to lifestyles of health and sustainability. Now, you can Google LOHAS right there, and they can tell you all about it, that there are a lot of people that are turning to different paths for naturally grown, range-fed, all kinds of things, and dentistry and medicine are falling into their lifestyles. Now,
is this an online publication, Peter?
They do. I think they do have a publication, but you just Google LOHAS and you'll come up with all kinds of data about them. So the New York Times says this may be the biggest market you've never heard of. This is 68 million adult Americans, and that's a third of the adult American population. So, and everybody in the last 10 years is kind of getting on the bandwagon marketing to this. You'll just see just everybody is looking for green, looking for healthy. So is your practice prepared to offer something to this particular market? So my thought is that these numbers are just too huge to ignore anymore. This is a third of your new patients, adult American patients, coming into your practice. If you knew how to ask the right questions, if you knew how to find out who they were coming through your front door. But this also means that this is 33% of your existing patient base. Now, getting to a third of your existing patient base, that's a whole different and a whole nother webcast, because that's a huge part of your business already. We're just going to concentrate on your new patients today. Try to make it easy.
Saying, yeah, and you're saying there's no, that this sort of cuts across, it's a demographic cross-section, that it's not based on income or education or ethnicity or location. It's just some people get it and others don't, but more and more are getting it.
It is based a little bit on education. You're going to find out. Let me back up just a little bit.
I would imagine there'd be at least some of that, and income and education would kind of would lead that a little bit.
Absolutely, absolutely. There are 60% of these are females. These are the people in LOHAS. These are the people who make decisions based on health and sustainability. Obviously, they aren't exactly a demographic group. They're people who think whole process wise, not, you know, what's the bargain sale today. They think more long range. They see their physicians, they see their dentists as advisors. They are the decision makers. They are least price sensitive in their community. So education has quite a bit to do with it, and it's part of the adult American population that we see in our town, in our practice. So let me go through all this again. That's just where we are with what America is doing these days. So when people are talking about buying organic and going green, it is green in more ways than one, and that is making sure that your patients and your business are being taken care of. And that's what we want to talk about tonight. So biocompatible patients are more valuable because they're the least price sensitive. They want to be healthy, and they're going to pay for it. And when they find the office that treats them the way they want to be treated, they feel more valued. So you are here tonight on this webcast because you want to grow your business. We know that. And you want to get your best dentistry off the shelf. Now, Tom, let me ask you a question. I know you got tons of education. You've had Dawson, you've been to LVI, you've been to Pankey, you've studied with Hornbrook for cosmetics. You've been working with this market and in your practice for a few years now, I know. How has this been for you on getting some of your best dentistry off the shelf when we talk about quadrant dentistry, things like that?
Well, I'll tell you what, Peter, everybody wants to grow their business one way or another. Some people just want to make more money. Others, growth to them means maybe getting an associate. So you have to be busy enough to get the associate busy. Maybe you want to retire or put in less hours and still make the same income. So there's lots of ways to grow your business. And to get your best dentistry off the shelf, I think we have to sit down, talk with your patient, get to know them, and find out what they truly want. And you go over everything in your bag of tricks, and you'll be surprised at how many people want what you have to offer. I'll tell you what, I'm a little tired of doing fillings all day long, you know, and I think many dentists will agree with me on that. But besides fillings, there's so many other things, you know, crowns, bridges, onlays, inlays, all kinds of attachments and dentures, and it goes on and on. And that's the things I like to do. Everybody has their own little niche, maybe sleep dentistry or whatever, and I think you can do more of that by talking with your patient and offering them what you have.
Well, let's talk about the night. Once we get onto this, we're going to talk about some of the diagnostic disciplines we've got available to us that we can have and offer to the patients. And we will be able to generate some well-deserved additional income if we just know what we want to look for. So that's where we want to double the new patient average value. If you feel trapped in your practice, you might want to reach out to this market, because this is where you've got patients who are more valuable and they feel more valued. So the new patient exam that we all were kind of educated on in dental school, that we carried over into our practice. This starts with the patient coming in, seeing the hygienist or seeing the doctor immediately. You get a medical history, you get some x-rays, you do the dentition exam, you do the perio exam, you treatment plan the patient, you get the financial arrangements. And if you're average across the United States, the new patient average value is about $1,500. So some of that happens when the new patient comes into hygiene. The doctor comes in for 5 minutes, and Tom, as you just said, you know, you're going to be able to offer this patient a lot of different avenues based on your own education, and to try to get that across in 5 or 10 minutes with the new patient appointment and hygiene is very tough to do. So I once asked, when I was in my master track courses, we were all going through the same boat. There must have been 30, 35 guys and girls in the mastership class, and I just asked them, because the professor asked, he says, you should never treat a stranger. So I just asked, I said, listen, let's just take a poll in class here. And there must have been 35 people there, and I said, you know, how many people are bringing new patients in through hygiene, and how many people are bringing patients in on the doctor's side? And I was surprised to see that about half or over half were bringing new patients in through hygiene. And my thought was that how are you going to completely diagnose a patient in 5 minutes and wind up with a $20,000 case and have the patient say, oh, I understand everything, you understand me, I understand you, let's go start this tomorrow. I had a hard problem with that. I've always seen my new patients on the doctor's side. So if you have an average of $1,500 per new patient, and if you get 30 new patients a month, that's $45,000 based on an average of $1,500. And just like Tom, what you just said, Tom, is that maybe you'd like to see less patients. And so if you doubled your new patient value, you could see 15 new patients, because I know new patients numbers are down on many practices. So this makes a lot of sense. So when we get to the dental school exam, The dental school type of exam is obsolete. It is dead because of this. It never could create the opportunity to build a long-term relationship with a new patient. It wasn't designed to do that. It was all about teeth and gums and some requirements that you needed, you know, because you had to graduate. You did not need a long-term relationship. You needed requirements in the prosthodontic department. So that's where we all learned our craft, and now there's a different way to do it with learning about the 7 diagnostic disciplines. So with the case study that I want to go over tonight, I just can't give you the old dental school type of exam and say, here's how many fillings there were, this is what his periodontal condition was. That won't do it, but we do have to start with that. What does the patient present with? We have to know that for sure. We've got to cover their medical history. We've got to find out what are their past dental experiences, what brought them to the office in the first place. Did they have bad experiences? Did they have good experiences? We've got to find out what are the goals they want to accomplish? Where are they going with this? Why are they in your office in the first place? And what procedures and protocols are necessary to get where they want to go? And above and beyond all, they are paying for results. So at some point in time, you need to pick up the mirror and explore and do something. But the rest of these bullet points right here all revolve around other things than the mirror and the explorer. So as I look at this, the past dental experiences, that's something you'd want to find out. What dentistry have they purchased in the past and why? Did it make any sense? Did they get the results that they wanted? Are they going to buy that again? Do they want something better this time? What do they want to accomplish with their dentistry?
Hey, Peter, do you think this has implications for the health history as well? I mean, I suspect that a lot of health histories could be updated to kind of prompt these when the forms are completed also, so that you even know this going in, which is nice. You know, it shows that you've read what they've shared, because I think often people only take a quick glance at the patient forms, and it kind of prepares you with who you're dealing with and what level maybe you want to begin the conversation.
Well, we've got, in my practice, I've got certain questions on the medical history. I want to know, are you immunosuppressed? You know, and if you are, and you've got periodontal disease, there's a huge problem. You're taking immunosuppressant drugs, and you've got moderate periodontitis. Maybe you've got a conflict there. Maybe you know, you don't have a lot of immune system to spare to fight your perio disease, or maybe because, you know, 1 to 2% of the population has an allergic reaction to aluminum or mercury or even titanium, but yet we're putting implants in people without finding out to begin with. Have you ever been tested for an allergy to titanium before you ask for an implant? So you're right, Danny. Those kinds of questions are important to pay attention. It opens up questions and allows the patient to say, does that matter? Should I be concerned with that? So, and those are the kind of things that you might want to put on your health history if they're not there already. So with the case study tonight, I've got 2 case studies, and I'd like the people attending to choose which one they'd like me to cover today. I've got case study number 11, case number 27. Let me just show you these right now. Number 11, this is a young man in finance. He's with Capital One in banking right now. I'll cover his case, or let me see, case number 27. It's a 66-year-old lady, Sandra, who is about ready to sell her insurance company, and Laith is his name, the 31-year-old. Medical history is kind of unremarkable. Nothing hurts. He did get sick after a couple of his mercury fillings were taken out. He's got some generalized recession. This is what he looks like. So that's case study number 11. We could talk about this guy, or talk about Sandra. Her medical history also is relatively unremarkable. She's had braces twice. She's got a bad bite. She's got a couple of cavities. So that's what she looks like. So you guys, if you would, choose case study 11 if you'd like to cover that particular one, or case number 27. So I'll leave it up, Danny, if you could ask them, you know, let everybody choose which one they'd like to cover.
I'd be delighted to, Peter. On your screen now, if you're an attendee, you should see the quick poll, which simply asks, which case study would you like to have Peter focus on, number 11 or number 27? And I don't know if people need, well, we're already getting quite a few respondents. We have 67%.
Yeah, let's give it a minute or two and see which one interests people more.
Do you want to perhaps review? Well, people aren't going to see that because the poll is open. Just if they can remember Leif and what was the young lady's name?
Sandra.
Sandra. Because right now we're a dead heat. Only 67%. I know that some people. I can tell if you're looking at the screen, folks. You're multitasking, and that's fine. But just for a moment, maybe let us know, because this is the direction we're going to take. And you know, like you said, Peter, we may have time to go through both anyway. And
well,
we're over a minute now. I'm going to close the poll and show you the results. And it was a dead heat. We were just 50-50.
Oh, man. Well, then I'll tell you what.
Okay.
Let me go through Leif first, and I'll go through it as quickly as I can. We probably will have enough time to get through both of them, because I think both of them are interesting because of various different reasons. So why don't I go ahead and do that? So let me go ahead and start with Leif. And Tom, if there's questions about this that you've got about why I did something or how you might have interpreted it differently, then jump right in with me, please. Okay. Because I'm going to start out with just regular teeth and gum dentistry, something I'd call, replacement of body parts is what we sometimes think of ourselves, is that we're just fixed teeth and that's it. So Leif had no perio, no gingivitis, no caries. He had one small fracture. He takes supplements. Nothing hurts. Nothing's wrong. He can't tell you anything's wrong. He did get sick after 2 silver mercury fillings were taken out. He's got generalized recession. That might be able to figure that out once he filled out his medical history and you picked up the Mirror Explorer and examined him in a 5 or a 10 or 15-minute new patient exam, and then told him what he needed. And that is what gives us that $1,500 average. Now, for dentistry with whole body health, I know he takes supplements. I know he's immunosuppressed. I know that nothing hurts. He's got 17 mercury fillings on 12 different teeth. The pathology and the infections part of the exam was negative. He does have occlusal disease. He wants to be tested for the materials. He works, he will work overtime or a second job to pay for this, and care credit has been obtained to help with payment of his case. Now, this case, oh, and also he denies snoring. So I'm trying to cover a lot of the disciplines right now when I talk to new patients and find out, why are you here? What are you doing? What do you want? Where are you going to be with this? And so this case turned out to be about $10,000, and he agreed to $10,000. Now, that wasn't my first offer. My first offer, I offered him my absolute best dentistry, which would have been inlays, onlays, and crowns for all of his 12 teeth. Had he taken that, this would have been a $17,000 case. So I have that mouth to work with. So as we go through this, and Tom, jump in here and help me with this. When we take a look at this, maybe 5-minute, 10-minute examinations, I can't tell you how many people come in to my office and I'll take a look at these abfractions and the gum recession, and the dentist and the hygienist said, well, you're brushing your teeth too hard, you're using a hard bristle toothbrush, do circles instead of that. What's your experience, Tom?
I hear that a lot. When I see abfractions, this is it. You can tell. Look at the worn incisal edges. Look at the tori he has on the lower. And I know these are abfractions. and they'll say, "Well, the last dentist told me not to brush so hard." I'm thinking, "Oh, you got more than brushing hard." I mean, it's obvious. And these are the type of things some people miss. You know,
yeah, and if the hygienist is trying to do the new patient exam and kind of help along with the doctor coming in, she might not be educated enough to kind of give this idea, except somehow she's got an idea that hard bristle toothbrushes are bad in her hygiene career, and looks like that's what you're doing.
Yeah.
But obviously, in the canines are going. He's lost all his canine disclusion. So now, in another part of the medical history, he said he got sick after 2 mercury fillings were removed. Now, that should bring up a red flag if you even got to that point where you have in your medical history, and Danny, you brought this up just 4 minutes ago, that if you've got a question on your medical history that says, you know, have you ever been tested for an allergy to your mercury in the mercury fillings? That could be a question you put on your health history, and they answer yes or no, and they say, well, should I be concerned? It opens up the conversation. So I'll tell you what happened with this young gentleman. He was born in the UK. He came over to the United States when he was 14 years old. And at 15 years old, he got all these fillings. And they're about 15, 16 years old right now. Immediately, he felt like there was something going on in his body that he did not like. He couldn't understand it, that something was wrong inside of him. He'll tell you that he started looking for the root cause. He wanted to find out what was going on. Nothing happened dramatically, except he knew that he wasn't quite right. He graduated from college. It took him, because he couldn't focus in class and he thought something was wrong, it took him 9 years to get his financial degree. But after he did get that, he got a job with banking with Capital One. But in college, he went to the psychologist, referred him to a psychiatrist for depression, put him on medications, and he started to become even more depressed. He was afraid of the drugs. He didn't especially want to put all those drugs in his body. They were making him feel different and more weird than he already did. He actually turned to opiates to kind of just get through the day. You know, sometimes people, and these are a lot of our patients, and we never ask, so we don't know, but a lot of patients are in divorces. A lot of patients have children who are upset in the household. You know, we've got stuff that we go through our day, and we're trying to get them to floss better. And it says, you know, they could easily come back like this guy did and say, listen, I'm just trying to get through the doggone day. You know, I may not be flossing perfectly anymore. I'm having troubles. I'm just trying to, you know, you don't get it. I'm just trying to get through today. And that was late. So the psychiatrist said, well, you're a drug addict, and that's your whole problem. But he, you know, he knew that, you know, there was no reliable source for opiates. He knew that wasn't an end thing for him. So he finally got tested. He had chest pains, lack of breathing. The EKGs were off the charts for him. There was atypical chest pain. He was struggling because he couldn't perform at work. And he was contemplating suicide. Didn't know how to leave his family, didn't know how to tell his family. And this was just 2 years ago now. And he wanted to leave his family as well off as he could without the burden of having the emotional burden of a suicide, but just the financial burden too. So he actually broke the news to his mother, and his mother said, and this patient was in Virginia Commonwealth University in Virginia, found a naturopath actually in Richmond and made an appointment for him and twisted his arm, and he actually went. And within 5 minutes, this person, as we know that over 30% of the American population are seeking alternative health care possibilities now, this person in Richmond, a naturopath, found his, or at least diagnosed his problem within the first 5 minutes. And the heavy metal toxicity and the anxiety, everything lined up with mercury poisoning, heavy metal toxicity. She had him on a detox and referred him to me, and so he is very anxious to get well. So this is someone who has a definite reason to become mercury-free, and obviously there's mercury-safe procedures that we'll go through, and we just can't drill out all these mercury fillings and splatter mercury all over the place. He'd go ballistic on that. If he got sick just after 2 silver mercury fillings coming out, we would put him under so bad if we didn't have a safe protocol when these mercury fillings came out. So I guess the main question is how do I know all that about him? How do I know that this went on? It's that in my new patient exam, I don't pick up the Mirror and Explorer until I understand why they're in my office, what they want done, how did they come to their present condition, and it only takes 10, 20 minutes. He actually was very open. So now he understands the mercury. Now he is very open, and I said, well, you know, you're 31 years old, Laith. You continue to abuse your teeth like this and destroy tooth structure from occlusal diseases. You're not going to have too much when you're 55 years old if we don't take into account. So there were a couple of disciplines now I'm approaching with him on. He denies snoring, but I see a little evidence that he's got sleep apnea, so we need to address that. But that what brings us up to a $10,000 case, and if we wanted to do it all in non-metal inlays and onlays, a $17,000 case.
I wanted to ask you about that, Peter, why you use the term denies snoring instead of does not snore. I suspected that you had reason to suspect that maybe he does. Is that why?
Yeah, there are certain things, and actually I'm going to cover that a little bit later because I've got something that will kind of direct you in that right direction of some of the diagnostic disciplines of what do you want to look for, what are 3 quick things you can look for that might indicate that this person has sleep apnea. So I will cover that.
Being one of them, I can see just from the picture, one of them.
Next side, yes, exactly. And things when you look inside, you can see the size of his tongue versus the pharyngeal pillars on the side back to the airways, and we'll cover that in just a minute. But that's an important question. That's an important question to ask a patient because of what sleep apnea is doing across the country and some of the legislation. I'll talk about that in just a minute too.
Great.
So,
Peter,
Tom,
what an interesting story. What a case. I mean, and when you get to know the patient and talk with the patient, I mean, this is a long cry from you need a crown and 2 fillings, which is kind of, when you look at them, you know, that's what typically I might have said. But when you get to know the patient, boy, this opens up a whole world of help for this guy. You know?
Yeah, Tom, yeah, you're right. This is a case where, you know, we think we'll help you with your lives, but once in a while you come across something like this where you just might save a life, not only through periodontal disease and the links with cardiovascular events and things like that, but this guy couldn't help himself. He was trying to get through the day. So yeah, you're right. He's a hell of a story, but how would you have helped this guy had you had a 5-minute new patient exam with him and you fixed one of his fractures, you gave him a night guard maybe, you know, $1,500.
Yeah, exactly.
So, so it's a simple case. When you look at him straight on, you say, okay, he's got a fairly nice little smile like that. There's a little wear here and there, and if you didn't really look at him, he has no perio. There's no pocket depths. There's some recession, some attachment loss, but no bleeding pockets. There's no pus. There's no blood. You know. This guy's okay. He's a regular prophy kind of guy, but what other things are going on with him and his life, and how does it turn around to be a case worth $10,000 or more? So what I'm telling everybody, I think, tonight is that there's a possibility that in the month you're going to run across one person, maybe 2, that's a $10,000 to a $20,000 case each month out of your new patient examinations. Now, what's that going to do to your bottom line and your income? That's the reason why we're talking tonight. So let me tell you, let me see if I can go through, let me see if Sandra's up next. I'll go through Sandra quickly also. Let me, yep, okay.
I can certainly see why Leif will thank you for it too.
Yeah. Yeah, he's a great guy. He says, and I asked him for permission to talk about his case. He says, absolutely, if I can help anybody out there. And I said, we'll be able to get to the dentist. Well, you'll help more than one person, another patient. You're going to help dentists help tens of patients or hundreds of patients. He was thrilled. And same with Sandra here. She says, absolutely, I'll help as much as I can. So Sandra is 66 years old. Medical history is unremarkable. She's had braces twice. She knows her bite is bad. She's got a couple of cavities right now. And if that's all it was, it might be a bite guard and a couple of fillings and a cleaning. And that's where it is. Okay, dentistry for whole body health, yes, her medical history is unremarkable, but you've got to ask, why was she going through braces twice? You know, did her jaw lock up? Does she have pain? She's got some temporomandibular disorder issues going on? What's going on here? Just not a bad bite. There's no perio, there's no fracture. She's got a couple of cavities. She's interested in prevention. She's 66 years old. She's starting to feel it now. She's starting to feel it. Her mother had heart problems. You're going to ask me, how the hell do you know these things? Well, that's when you start asking a couple of questions that delves a little bit deeper than the 5 to 10 minute new patient exam. I usually take 10 to 15 minutes just on an interview, a structured interview. So with her, she had bite problems. She had braces to try to correct it. They told her she'd have to bust up her jaw to correct her bite. And she said she just was totally against that. She didn't want to do that. She's interested in prevention. She's got tooth number 3. It's a root canal. It's failing without question. Her fillings are over 70% of the teeth. And usually in my office, if I've got, you know, a filling that comes in at 25% of the tooth, it's relatively small. You got 75% of the tooth left to protect that filling and 75% of the tooth to chew on. That ratio is good. You get up to 50% where there's half tooth and half filling. You go much more than that where you got 60, 65% of the tooth is filling and you've only got 35% of natural tooth left. Well, there's not much tooth left to put a new filling in. So we're now talking onlays or full coverage crowns. So she's got that. Her mother had heart disease and she's concerned that runs in the family. She wants to be as healthy as she possibly can. She's interested in prevention. So we don't know this until you start talking to the patient, say, why are you here today? She wants to save her own health. She's got temporomandibular disorders because her bite has shifted over the years. This is a $17,000 case, and if we deal with her bite, it's probably almost a $20,000 case. Now, this is what she presents with. You can see her curve of SPE is like super depressed because those teeth came out and the maxillary teeth super erupted. So the dentists that she's been with have just built her in that same occlusal pattern. So we are going to change the entire occlusal pattern because she's not only interested in her health, which with a little education about, well, okay, you've got a bunch of dissimilar metals in your mouth, you've got some mercury in your mouth, this tooth number 3 is got an infected root canal that has to come out. She's got crowns all over the place. So this is a total rebuild. And her history is that she told, this tooth number 3 is a root canal that's failed. She was told this is going to take a lot of surgery and a lot of antibiotics to get over this thing. And she didn't want to take any more antibiotics because, like I said, there's a lot of the American adult population that are taking more supplements, going more organic, staying away from all the drugs that come when you go to a physician. So tooth number 3 was starting to bother her. I think that's what got her going in the first place. She knew she was going downhill, and She didn't want to take a lot of the extra, a whole another round of antibiotics. So we have extracted tooth number 3, and I can't tell you how much granulomatous infected tissue was up around the apex. A retreat would not have sufficed. An apicoectomy would not have sufficed. And if she didn't have pain, I'll bet you that half the dentists across the country would say this is a successful root canal if the patient can chew on it and it's pain-free. Even if they see the x-ray that's got some radiolucency around the apex, they might call that a bone scar. I know my oral surgeon, I've sent things, I'd like an apicoectomy on this tooth number 12 or something, and they said, well, I talked to your patient, I think it's just a bone scar, I sent her back to you. I said, no, don't do that. Something's up there destroying bone. It's not filled in. The root canal was done 14 years ago. So these things are taken to my own hands these days. So when we're done with her, and we're not quite done with her, she will be a $20,000 case probably, only because she wants to go into a prevention mode to have as healthy of a life as she can. So, Tom, any ideas, any questions or comments about this case?
Interesting case. I was just listening to you. That number 3, I can't believe the oral surgeon denied that. I mean, that's incredible. So yeah. You took that tooth out, I imagine, and you're going to rebuild it, get a proper curve of spee, upper and lower arch.
Yes. She wants all these dissimilar metals gone, and part of that was the open conversation we had about what's going on in her mouth, and the acupunctural meridians and the dissimilar metals and everything that's going on in her life and in her mouth. She's not terribly cosmetically conscious, but that's one of the disciplines I took into account because, my gosh, Tom, with your education, studying with Hornbrook and LVI, I mean, you turned me on to Durathin veneers a year or two ago. Fabulous veneers. You're a cosmetic guy out there. Cosmetics are one thing that she will take on after we get her bite right, and she wants to do something with the maxillary and the mandibular anteriors.
Peter, I get that a lot. After I fix many of their problems, at the end they'll say, you know what, I went this far. I just had a case the other day. We need to do a lot of work, had missing teeth, bridges, crowns, and let's talk about fixing my front teeth, tetracycline stains. You need a lot of veneers. They are healthy, they want to be health conscious, and now they want to look good.
Yeah.
I can't blame them.
Well, I don't think we understand enough about this population that we're dealing with here. Is that oh my gosh, how many? 10,000 baby boomers turn 65 every day right now, and it's that generation that has the most discretionary dollars at their disposal, and they want to look good and feel good,
and they want it now.
And they want it now, and we can do both of those things for them. We can make them look good, and we can make them feel good. Because sleep apnea is one of the disciplines that we got to talk about. That people are feeling ill and tired, and the dentistry can help that. Everybody doesn't want a CPAP machine with mild to moderate apnea. So we'll talk about that in just a minute. Anything more about this case, Tom, that has got you? You want to make a comment?
No, I think you covered it.
All right. On both of these, on number 11 and number 27 case studies, I find that if somebody has, because my gosh, I can't tell you, people are coming in saying, my sister-in-law out in Arizona got all the mercury out. She's been talking about it. I found this out. I looked it up on the internet. I was asking about it. I found you online, or somebody told me about you in town. So once we talk to them about why are you interested in thinking about your mercury fillings? What are you thinking? Tell me what you're thinking. Once they understand that and they are concerned for their health, it opens up the opportunity for a conversation about occlusal disease or sleep apnea or aesthetics or perio. That all falls into whole body health because of what we do in the mouth and how it impacts whole body health. So that's the kind of thing I want to get across today, is that these patients, might come in for one small problem, but they understand the investment they want in their health. And these people that are in the lifestyles of health and sustainability, they are, like I said, they're the least price sensitive, and they want results. So they spend money, they shop. So can you offer them a dentistry, a style of dentistry that fits into their lifestyle? Big question to ask. So let me just go through. Let me tell you. So just talking about adding $1,000 to every new patient treatment plan, or doubling your new patient value, and have your patients thank you for it. So the 7 diagnostic disciplines. Now, let me go through every discipline and kind of tell you why we would look at these 7 things in a kind of a sequence, because these are what matter in whole body health to the patient, and they are in our charge as dentists, because periodontal disease, we know, periodontal disease, the most prevalent chronic inflammatory disease on the planet, bar none. So it is something that we have to deal with. It's in our realm to address this, and we can change the health of the nation. It's often thought of as a dental problem, at least back in the 70s, 80s, and 90s. We now know that this is a medical problem with a dental solution, and we need to follow the medical model rather than the kind of mechanical model that we've always done. It'll take, and I'll guarantee you this, it'll take your hygienist from an $800 per day to a $1,600 day. That's what we're dealing with when it comes to periodontal disease. Now, the second one is the restorative that we do with biocompatible materials. Now, this is my area of specialty right here. I'm not a periodontist, but with my education, I am well versed in the biocompatible materials, because this area is where we all love to fix teeth. That's what we do. But we know that the mouth is a powerful place on the body. It impacts the whole body health of a patient positively or negatively. Now, these are the things that you have to kind of take into consideration when you talk about what are we putting in this mouth. We're putting foreign bodies, foreign objects in the mouth, and maybe we ought to take a little closer look, because this is what happens around the mouth. A third of the cranial nerves that exit the brainstem go to the lower third of the face. The anterior teeth are associated with the sympathetic nervous system teeth. The posterior teeth are associated with the parasympathetic nervous system. The acupunctural meridians, all 12 of them, run through the mouth and are associated with individual teeth. So, why is the mouth so wired for power? It's a very powerful place. There's no other place on the body that breathes in life's breath. There's no other place in the body that tastes. There's no other place in the body that smiles and frowns with emotions. No other place in the body that eats. And certainly there's no other place in the body that speaks or talks. So if the lower third of the face is not the most interesting place on the body, it's got to be the most powerful place on the body. So are we starting to feel like we're dealing with something significant here with our profession? So I think that we're going to understand just how important dentists are when it comes to prevention of diseases and cancers. And I've been told that personally by an oncologist that I've worked with for many, many years. So we put dissimilar metals into the mouth. We set up electromagnetic interactions between these metals, and some metals have a more powerful radius than others. But because the mouth is such a powerful place in the body to begin with, what materials we use to restore the mouth becomes important. So you need the verbal skills are so important here when you want to talk to the patient in the language of the patient about what matters to the patient. So that's my area that I particularly get on my soapbox about. So the next one is...
That's what you helped me a lot with in my career, is biocompatible materials and how to get that going in my practice, and that was big for me.
Well, good. Well, I appreciate it, Tom. Thank you for saying that. So, and here comes an expertise for you. It's aesthetic and orthodontic concerns. It says this is where we take care of the emotional needs of our patients, something that we don't want to ignore. I mean, in my practice, we want to take care of the physical, the emotional, the aesthetic needs of our patients to maintain their well-being. But this is and this is the place where we want to take care of all those baby boomers with aesthetics. We can make them feel good and look good at the same time. This is where we do it. The fourth diagnostic discipline, obviously, temporomandibular disorders. It's just like any other joint in the body. If the TMJ is abused, it will stop working correctly. So you look for pain, you look for tenderness, you listen for clicking and popping and crepitus, deviation of motion, things like that. It's a tough one if you don't have the education to kind of look at it, but I've got a way you can take a look at it in a quick diagnostic way to help out. Occlusal disease. This I think ought to be closer to the top for me. I've got it down here at number 5, but it ought to be right along up there with perio and the restorative stuff that we're doing, because how many people show up in your office with worn occlusion, wear facets, interferences, those inadequate curves of SPE, inadequate curves of Wilson's? It's like, oh my gosh, it's like an epidemic in my office. It's occlusal disease, and I don't ignore it at all anymore. So, but it's a huge part of helping the value of your treatment plans increase. The occlusal disease is something that I pay a close attention to. Number 6, sleep apnea. This is a discipline that's getting national attention these days because of the accident deaths of truck drivers, of railroad engineers, of they've got legislation right now. That's in to get airline pilots tested for sleep apnea. This is just another discipline that brings the evolution of dentistry into whole body dental care. So this is what I pay attention to quite a lot also. You might want to work with sleep labs in your area to do that. Number 7 is pathology and infections. I already told you about Sandra's tooth number 3 was successful the day before she had it out because it wasn't painful, but obviously it wasn't. So in all of us, Tom, you've had to have this too. By this time in your career, you've had to have extracted enough teeth to see the cystic material, the granulomatous material attached to the apex of that extracted tooth, right?
All of the time.
Yeah, all of the time. Yeah, everybody has. So root canals are far less successful than we realize, I think. So you can generate a more complete treatment plan the more you know about your patient, and the more you know, the more you're able to influence and serve your patients. So this is where we start to double the value of your new patient exam. So right now, I want to go beyond just telling you about the statistics that prove my point. I'm going to show you a couple of things that I'm going to make you an offer, actually. I've got a special report, 33 pages in this report, of all the diagnostic disciplines. There's a separate section for each discipline, and there's a quick look diagnostic checklist for each of the disciplines also. So these quick look diagnostics cover each one, and so there's just 2 or 3 or 4 things on each particular diagnostic discipline that you can check out very quickly in your new patient exam to see, are you going to be concerned with this for this patient? Now, this is a report that I've developed over the past couple of years, and I want to put it in your hands. There's also a self-test in this report too that you can take on your own for diagnosing dentistry for whole body health. And you can see down here on the left-hand side, the 7 diagnostic disciplines are down there. And across the top, it is treatment planning range of fees, and you can take a look at those as what they might be if diagnosed and accepted. But across the points, you get different points there in this test if you have a system to diagnose and you implement that system. You give yourself 10 points, each one of those. If you have a system and diagnose it, but you refer, well, give yourself 5 points. In the next column, if you've got a system to diagnose but you don't implement or refer, give yourself 2 points. And if you've got no system at all, just got no points. So you add up all your points and you come to a realization that you're doing very well for yourself, or you've got to check yourself out of the helpless ward and start diagnosing your patients and seeing these things, because I guarantee you 30% of your patients have these issues that will be willing and waiting to hear what you've got to say about them for their health. So this is a place where you can rate yourself. Now, I'm also going to give you my personal cheat sheets on every one of these disciplines. There's the standards and criteria for reporting periodontal concerns. There must be 18 things there. Biocompatible restorative concerns, there must be 20 things there. Criteria for aesthetics, for TMD, for sleep apnea, for infections, for occlusal disease. These are my ultimate cheat sheets. I'm going to put those in there right now. So this is what you'd get right now. The 33 pages of the report, the self-test just to rate yourself to see where you are, and all of my cheat sheets on every single one of the disciplines. And I figured, $1 a discipline. So let's just do $7. So how does this, go back to the first of the questions, how does this help the practice? How does this help the new patient? And these are the answers. Your business will benefit because your average new patient value has just exploded. This is going to skyrocket the dollar value of your treatment plan so you can present and treat more quadrant and full mouth cases, and that will improve your bottom line and income. Now, Tom, I know since all of our conversations in the past, I know that you've been doing quadrant style dentistry for quite a while. How does biocompatible dentistry kind of fit into your picture? Did it just dovetail right into how you think?
Absolutely. I'm doing more quadrant dentistry and more, especially with biocompatible dentistry. They want those mercury fillings out of there. They don't want to get Alzheimer's. They don't want to have immunosuppressed problems. They want to be healthy. And so it's much more easier to diagnose and treat cases like that. Yeah.
I guess I got a follow-up question on that, if you don't mind, Peter.
Yeah.
For Tom. What did your practice look like before you adopted Peter's protocols? In other words, was this a culture shock both for the team and the patients, or had you been gradually moving in this direction? That would really help me kind of understand, because I can imagine a lot of our attendees are at various points on the continuum. I mean, everyone on this call pretty much gets oral systemic health. But when you're talking biocompatible, and I think an issue that people have, I just talked to a client the other day that bought a practice, and a lot of the patients, well, the patients of the practice that he bought had a dentist who would like to watch things. You know what we mean by that. And it was essentially, another way of putting it, he was practicing benign neglect, or basically telling people what they want to hear versus what they need to hear. And this doctor was rather frustrated that people were leaving, and I explained, I said, just based on what you told me, I think they're probably shooting the messenger, and it's a matter of not knowing just what to say, but when and how to say it. So I'm just curious to know kind of what your story or evolution has been.
Oh, you slowly build up to this, and I've always wanted to do quadrant dentistry, and I learned how to do that, but I could never sell it. And now with the advent of, the start of my biocompatible practice, it's so easy to get off the shelf. And once you talk with the patient, get to know them, they'll tell you what they want, and you just deliver. So it makes it so much easier to sell, especially when you look at all the 7 disciplines. There's lots you can do for that patient, and it's just easy now. I don't know. Over time, doubling the practice is simple. All your new patients. I mean, you can do much more than that.
Would you say that the glue, if you will, that binds the communication is for many people this new concept of biocompatibility, which can answer a lot of their questions and address their concerns? And I think the premise that Peter began with is that more and more of the country is going green. Personal story for me, I just had an epiphany last week. I've been eating healthy and everything, but using green, like household cleansers and materials like that, it didn't really ever appeal or resonate with me. But last week, and I'm not even sure why, all of a sudden I thought, you know, that's the next step. I got to create a healthy environment for me, and I don't want to be smelling these fumes or polluting the environment. So is that kind of the glue, that concept of biocompatibility, or does it go a little broader or deeper than that?
No, from my point of view, it says, you know, everybody's kind of understanding that mercury fillings are out there, and it's coming more and more. And when they open up that conversation, that gives you permission to talk about their health. And when people want their mercury out, they say, you know, they say, well, I've got insurance. Will my insurance cover it? And they say, well, of course it will. It's just taking out a filling and putting in new fillings or whatever. But you know. Then they say, well, you know, do you want to have that mercury in your mouth for the next 4 years and you know, do a quadrant a year? And so the point of it comes to be, he says, no, I don't want. I want the mercury out now. Take it out with safe protocol. I don't want to wait 4 years to get the last of the mercury out. So that seems to be, Danny, the stimulus that gets people talking about this a little bit more. And it's just an unfair advantage, frankly, of having it over a regular dentist. And Tom noted this, is that trying to sell quadrant dentistry and some of your best advanced techniques and strategies, it's a tough sell out there. But when somebody understands that all these things involve their health, sleep apnea, you name it, sleep apnea is one, like I said, that I'm big with, because the brain has to detox at nighttime. If it doesn't, and there's just recent research on this from NYU and from a neurologist at LSU, if the brain does not go to deep sleep, and I forget whether it's beta or delta waves, I'm not the expert there, if it doesn't go there for any length of time, it can't detox. So these micro awakenings of the brain bringing you up for air may be contributing to premature aging and cognitive awareness disorders. So, I mean, people are tying things in all over the place about what we do in the mouth and how it impacts whole body health. The mercury is just what's in the news right now and has been for, you know, about 4, 5, 6, 7 years, pretty heavy. So that opens up the conversation for quadrant dentistry, because you don't want your exposures to mercury to be 17 times with 17 fillings, you know, maybe just 4 times, and you don't want the mercury fillings in there for 4 years. Get them out in the next 4 weeks or the next 4 months. I know I'm going to pay for it over the next 4 years, but that's where care credit comes in.
That's excellent. Conversation starters, getting people to ask questions and then getting them to confirm that the answer to the question is satisfactory, that it resonates with them. It's just like watching the bells go off. What's important to this person? Watching
the bells go off. Well, let me tell you the second best thing. This is how it benefits you, the dentist, because it's going to detail what you can do to serve your patients better by being the best diagnostician you can be. You're going to be able to influence your patients more, to accept your best care, which will, along with some increased personal satisfaction, it's going to improve your bottom line and income. Now, you know,
Peter, it's a lot more fun too, for me. It's more fun going into work instead of those darn fillings every day.
Yeah, I totally get it. And the benefit to your patient is they're going to benefit because they've never been to a dentist like you before. They say, and I've had this happen many, many times, no dentist has ever talked to me like this before. It's like they're bewildered. Why are you different? Because they now have a perception that you are different, and of your ability and willingness to help them, which validates their cooperation and trust in you, and that translates into a thank you. This is where we're going with this. So Let me show you how this is going to improve your bottom line and income. Care credit is used by most of us these days, and I had them pull up some stats on my practice, how it was doing compared to others. And this is what happened. They took the top 10% of the practices in my area, all of them. How many ever in the top 10%? They took all those practices, and I gauged them against mine. They had 306 applications. I had 5 in the same time period. And I don't know how many practices are in the top 10%, but there's several practices in the top 10% maybe. My practice, I had 5 applications. The amount approved in the top 10% of the other practices was almost $500,000, $460,000. I was approved for $57,000 in the same time period, my solo practice. Their average amount was about $1,500. Does that sound familiar to anybody? This is very average stuff. My average amount per applicant, $11,546.80. This is 7.5 times the amount of the average dental practice. So when you talk about periodontal disease, when you talk about sleep apnea, if you're unhappy with the lack of production that you're getting from your new patients and you're getting little or none of your advanced procedures off of the shelf, if your new patient numbers are down, this is the, it's like, this is the answer for getting your practice stabilized when everybody's feeling the economic crunch. Now,
Peter, I got to tell you, this was about a year ago. Care Credit sent me a letter, and they wanted to talk to me. Unsolicited, they called me and they sent me a letter. They said the average practice in my area, I don't know what the exact numbers were, but like they said last year they did X amount, and my office did, I don't remember exactly, it was like 3X, okay? And they wanted to talk to me, how are you doing this? And I had a talk with them, and then they said, well, can we talk with your receptionist? They asked me for permission, and I said, yeah, and they had a little, meeting with us because they wanted to teach other dentists, and basically it's what you're teaching right now.
Yes, absolutely, Tom. So in the regular offices that we've talked with and we have coached, they're the top 3 issues that the offices have. Actually, there's a bunch of issues. Decrease the number of new patients. Nobody's accepting the best care. Retirement's not being funded fully. No one in my office is on board with my mission. We need increase in productivity. The referrals are slow. Marketing dollars are up. And this all affects their home life. Now, the top 3 issues that surface on all the practices that we coach with are these. Decrease in the number of new patients. We can help that because even though they're decreased, we can double the average new patient value. No one is accepting your best option care. We've got systems and strategies for them to understand the 7 diagnostic disciplines. And number 5, they needed increase in productivity, which also meant increase in profitability, which when you have doubled your new patient average value, your productivity and profitability is going to increase. So this is what I want to put in your hands right now. The 33-page report, the self-test for you, all of the cheat sheets for $7. Now, I know that, I could sell this for $197 if I wanted to. So all the information is itemized, it's categorized, it's bite-sized, it's straightforward. So that just lets you see certain patients in a different light, and those kind of numbers are possible. At least once a month, I have a patient that comes to me that does this. So this is the 7 diagnostic disciplines, and for $7, why is increasing the new patient value so important is because it is the quickest way that I know of to increase your practice productivity and profitability. And here's the system to help you accomplish that. So that's for $7, and the website is thebiocompatibledentist.com /WBD, which is whole body dentistry /report. So I hope that has been helpful to lots of you out there, and I hope you take advantage of me and ask any questions that you have right now. We've got a few minutes left. I know I went over that second case, which took a little extra time, but I think it might have been beneficial. So
I think it was great.
Let's open
Peter.
it up,
Thanks
Danny.
a lot. And I don't know if that was a slip of the tongue, but I think at $7 people will be taking advantage of you. But that's very generous, and I know that your reason for doing that is to I just identify who the motivated people are, establish a relationship with them, and at least some of them will wind up wanting to learn more at some point, but it's completely optional.
Put it in as many hands as we can, frankly.
Right.
And $7 can't be too much to go. $1 for discipline, can't beat it.
Yeah, I think that's a pretty good deal. I could take credit for negotiating that with you, but that's what your opening bid was. I tried to go to 70 cents, but you'd have none of it. So.
None of it.
You probably would have gone with that too. All right, you're right. We've got some time here. That was fantastic, Peter. Thanks for the update. I enjoyed hearing from you when we last hosted you, and it's just getting better. Let's because it is evolving, as you said, the whole field of biocompatible dental care. Let's jump into some questions here. First one, where are you getting most of your new biocompatible patients? I guess this is a marketing question.
Yeah, most biocompatible patients are coming from the internet. People are researching everything. Yellow pages are gone, obviously. If you've got something that you want to offer, people are going to start looking for holistic dentists. They're going to look for mercury-safe dentistry. They're going to look for amalgam-free this. They're going to look for something. If you've got to have something in your website that when they show up, they see what they want to see. They want the results. So
Right.
you can't put anything in the newspaper. You can't put anything in the local magazines. I've already tried that. I've done all that research for you. It works barely to cover most of the costs, and I do this all the time. I always test these markets so I can tell everybody what's working, what's not working. Get somebody that'll handle your website, and people will call up, and they'll say, I want all my mercury fillings out, and it baffles me sometimes because Danny, you're the guy that has the phone scripts on how to get people in the office, but if somebody called up and said, I'm thinking about getting I'm getting married in August, and I want to get some veneers on my teeth. The front desk would say, oh yeah, we can do that. Let me get the doctor. We'll tell you all about that. But if somebody called up and said, I'd like to get my mercury fillings out, the receptionist, if they're not trained, they're going to say, hey, what do I say?
Hold, please.
Hold, please. And if the doctor got on that call, and talked to that person and wasn't aware of the verbal skills and said, okay, well, Jennifer, yes, I know you want to get your mercury fillings out, but you know that the American Dental Association said there's nothing wrong with your mercury fillings. They're absolutely safe and they're cost effective, and but there's no health risks at all. But if you want me to get your mercury fillings out, sure, I'll put white fillings in your teeth, but I don't think you should be doing that. Well, you can bet she's going to get her mercury fillings out, but it's not going to be with him. Now, if you took the same kind of attitude to the other patient, the other $16,000 case, one who wanted to be healthy and the other who wanted to be pretty, if you came with the same attitude to an elective $16,000 case, you'd say, hey, Jennifer, I just heard you want to get veneers all over your teeth because you're getting married. I said, I don't know what you've been looking at. You've been on the internet or what magazines you're reading, but the American Dental Association doesn't have any research that says you're actually going to become attractive and with any scientific general parameters. So yeah, I can
Great
put
analogy.
I can put the white veneers on your teeth if you want me to, but so does she have any confidence in him? So you can't, this is elective dentistry. So
right.
The verbal skills are critical on these diagnostic disciplines. So
all the more important. Right.
Got
And
it.
you know, we in the telephone skills curriculum, one of many points we make is that 95% of the calls you receive are predictable. If this is something you offer, if this is something you're investing in marketing to get such phone calls, it's incumbent upon you to be sure that you and your team are well versed and trained to very deftly respond with the verbiage and to do it enthusiastically, as you just said. I would also agree that for terms having to do with biocompatible dentistry, that the internet is most likely the best source, because these people are doing research. And these days, where do people do research? Do they go onto the Red Book? Do they go to the library? Not really anymore. They don't. They go online because it's right there in their living room. And we know that because obviously you know that website maintenance and marketing is a big part of what we do, that the terms, what were once called long-tail terms, and they still are to a large extent, that is terms that are at the long end of the bell-shaped curve. They're rarely used. The numbers of searches for these previously long-tail terms are increasing, and even if they're small, because they're so precise, there's study after study that shows that the more precise the search term, the more motivated the searcher, and therefore the more likely you're going to have a favorable conversion. So I highly encourage anyone that's interested in enhancing and expanding their practice in this direction, that they do optimize their website for these terms. And of course, I'm happy to talk to any of you who are interested in doing that. Let's move on to the next. Go ahead, Tom.
I agree. That's why I briefly say, after all that, these people refer their friends who are also health conscious. So a lot of these people just spread the word, and you get a lot more patients than just one from the internet. They tell their friends.
Excellent point. The more good you do for somebody, the bigger the ambassador they will be for your practice. And this is a quintessential example of that, because as you said, in some cases you're saving their lives, or saving their marriage at least, in the case of sleep apnea. Maybe.
And I always say that I'm all for being a profitable dentist, because I want to do good by doing well. So I want to be profitable enough that I've got everything that I want to do good for my patient base. So
do well by doing good. That's the
for
motto
that
I
matter,
live by.
Anybody that wants to check out my website is evansdentalcare.com. So you can take a look and see what my website looks like, evansdentalcare.com. And go take a look at that as an example. We get calls every single day. We're driving people through the site.
I guess I should point out, too, for those of you who maybe you're not viewing the screen, that in order to get the report, the 7 Diagnostic Disciplines report, you'll want to go to the biocompatible-dentist.com/WBD/report. And now we have it recorded for posterity.
Good, thank you.
Next question. Sure thing. How does the staff fit into this increased responsibility in the office? Good question.
That's an important question. You can't go to the office every single day and like pulling on a rope, getting your staff to follow you where you want to go. But I'll tell you, when patients come in and they thank you for spending $17,000 in your office, when you're, everybody should get a little bit of that bonus pie. If you're going to double your practice, there ought to be some kind of incentive in there, I think. But it also goes is that, if you're just replacing body parts and, you just fixing teeth, that's a job. But I'll tell you, when you help somebody with their health, that's a mission. So it's a whole different world out there with the people who are in the practice to help people with their health. And if you're just hiring somebody from McDonald's to run your front desk and answer phones, I think you're making a mistake, unless she is top-notch, bubbly, enthusiastic, wants to learn and help. It would be a gem then, because you want somebody answering your phones that's just outgoing and happy and, hey, come on,
That's right, because I agree with everything you're saying. First of all, the people in this profession do care, and they're there because they got into the field because they want to help people. And when you're providing them with this feedback. That's wonderful, and that might even be sufficient for people. But when your practice is growing and prospering, I think people want and deserve to participate in the upside financially as well. They deserve it. It's funny that you mentioned McDonald's. It's often, I tell people that, one of the ironies is that in the dental office we pay the person who we pay the least is the one who's in a position to make the first impression, and that's the person who answers the call. That person needs to be motivated and have a unique skill set of his or her own. And frankly, it's more often found in the retail sector than in the dental sector, because people had not been really asked or required to exhibit these skills until fairly recently. And it's funny you mentioned McDonald's, because there is a McDonald's where I don't eat almost ever. I do get the egg white sandwich once in a while, but I will go there for a cup of coffee. And I'm astounded at the quality of the service there and at how little these people are being paid. And I'm thinking, this is like a farm league as far as I'm concerned. And if I were a dentist, these are the people I'd hire, because you can probably triple their income overnight. And they're going to be very motivated by that. And they present to you with a skill set. They already understand how to satisfy people. They've been trained and they've been hired for that purpose alone. So don't underestimate the value and the importance of your front desk people. They're the ones that are really going to make or break your practice in terms of converting calls into appointments and setting the tone for the experience that you're going to have with the patient and that the patient is going to have with you. Next question. How do you go through your new patient exam, Dr. Evans?
Have we got time? Are we running? Where are we on time?
We got 3 minutes.
All right. Let me just go through it real quick. I'll give you.
And before you do that, let me just apologize. We got a number of other questions. I will share them with Dr. Evans, and he will, as he promised, respond to you offline on those.
Certainly will. Well, with my new patient, I spend about an hour with every new patient. Now, some dentists say, well, I can't spend that much time. I got 40 new patients coming in every single day. I said, well, then with your $1,500, at average cost, then average value, then you're getting what you want. But in my office, an average new patient value is close to $8,000 to $10,000. So I can see much less new patients and be much more sane, but I would go in with a 10 to 15 minute structured interview to begin with, and we've actually got a course on this whole thing about a structured interview and an examination and all that kind of stuff. If you want to know more about it, you can certainly go through that path of the biocompatibledentist.com on the report, and it'll take you there too, probably. But I don't pick up the mirror and explore for about 15 minutes. I have a structured set of questions that follow these 7 diagnostic disciplines, and in that particular course called the top 10 new patient questions, we go through all of those verbal skills. But I will sit there with a note card and with a notepad and take notes when I find out why they're in my office, what do they want, how long are they going to be there, 10 different questions I'm asking before I even take photographs, take x-rays, dentition charting, TMD. I go through all of the 7 diagnostic disciplines, and then if it's less than a $2,000 case, I'll present the case right then. If it's more than $2,000, I tell them, listen, I've got to study your case before I know what I'm talking about, and I think you'd rather have me well-versed with what I'm talking about. So I have them come back and then do a case presentation, which is a whole other set of verbal skills.
Mm-hmm.
So briefly,
I would submit, Peter, that is actually self-fulfilling, because we talked about this a little bit in another context, but rushing through the new patient exam is a quintessential example, in my opinion, of being minute-wise and dollar-foolish.
Correct.
This is your opportunity to establish a connection and to learn about what is important to this patient. It's time well spent. And as you said, if you're going to be, would you rather close, 50% of 10 cases Would you just rather close more cases regardless of how many you present to? If at the end of the day, just reduce it to the dollars, your money ahead anyway. But you just can't rush this. People are coming in now with all sorts of baggage and concerns and misconceptions and ignorance about a lot of things that are really important to them. And I think you do them a disservice by rushing through it in 5 minutes. So I think, personally, if you take nothing else away from this presentation today, you realize that this is time. But it can't just be like chewing the fat. Like, you've got to be structured. I would hope that you would offer that as well. That structured interview is really valuable.
It is. It is indeed.
All right. Okay, well, I just want to thank you again for another terrific presentation, and this time especially for making it so simple for attendees to benefit from your offering with that incredible offer. I hope that everybody takes advantage of it. I also hope that you'll mark your calendars for Thursday, July 16th at 6:30 p.m. Central Time, when our special guest, originally from Australia, but now practicing here in the good old US of A, will be Roger Price, who will present a case study on sleep disorders entitled Another Perspective, looking after the patient attached to the symptoms. In the meantime, this is Danny Bobrow, as always, thanking you for your commitment to practice perfection. Goodbye, everybody.